Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We have discussed clinical application of Dravya with Vasa, Yashtimadhu, Guduchi, and I have tried to explain how a drug can be studied and its clinical applications can be studied in different ways. Hope you have understand that and you can study the other drugs on that platform or on that basis. So after that a little side track of our lecture series regarding Dravya, we will move backwards to the original track, that is diseases of different srotasas. I have completed Annava Srotas and now we will move towards the Raktavaha Srotas. The main disease of Raktava Srotas, of course all diseases are main or important, but today we will discuss the disease Rakta Pitta. The disease name itself shows that the disease where Rakta and Pitta are coming together and creating some symptoms like bleeding disorders. You all know that. The question is, in Sharirik Kriya, we say that there is Rakta and Pitta Sahacharya. Okay? And the same two factors which are associated normally in the body, they only come together and make the disease. What is the difference is there? The disease definition of Vyadhi is, one of the definition is Dosha Dushya Samurchana Janito Vyadhi. So on the background of this Rakta Pitta, let us discuss Dosha Dushya Samurchana and its meaning. In normal Swastha patient or not patient, in Swastha Manushya, Rakta and Pitta are associated and they are working together without any problem. And when Rakta Pitta Vyadhi will name on that symptom on the patient's body, it is Dosha Dushya Samurchana, means Pitta Dosh and Rakta Dushya. Their Samurchana creates Rakta Pitta Vyadhi. So what is the difference between Dosha and Dhatu Sahacharya, and what it means by Dosha Dushya Samurchana? With the same Dosha and Dhatu coming in Prakruta Avastha and same Dosha and Dhatu as a Dushya. So meaning of Samurchana, always remember, when two or more Padartha come together to form a totally different or abnormal Padartha, it is Samurchana. When we say Rakta and Pitta Sahacharya, they are working together, associated together in a very normal way. And when there is Samurchana, it means they are coming together in an abnormal way, and the Samurchana means the product of their association is different totally or abnormal. Hence, Kajjali in Rasya Shastra, we name it as the Parad Gandhak Samurchana. What it means? The product which is now, or Padartha which is now ready after mixing of Parad and Gandhak or association of Parad and Gandhak is totally different than normal Parad and normal Gandhak. The properties of Kajjali, physical as well as other properties, oral physiological properties, are altogether different than the individual Parad and individual Gandhak. But when they get associated and this different Padartha is formed, we call it as a Samurchana. So what is the difference? When Rakta and Pitta in Swastha Manusya there is Sahacharya, they are working normally, and when we term is that Pitta Dosh and Rakta Dushya Samurchana, something abnormal entity has been formed in the body. So this is the difference between the normal Sahacharya and same Sahacharya when it is termed as Samurchana. So by name, Rakta and Pitta are the two factors creating the disease. Hetu of the Rakta Pitta are very very important, which are you almost know. Pitta Prakopak, Rakta Dushtikara, that too mainly Tikshna, Ushna Padartha, Vidahi Padartha, Jagran, Atapa Sevan. So all these hetu mainly, in all these hetus mainly two guna or properties are important which are responsible for Rakta Pitta. Which are they? One is Ushna Guna and other is Tikshna Guna. If you go through the all hetus, you will find that all hetus are cause of the increase of Tikshna and Ushna Guna in the body. This is the first main thing to be remembered. Second thing, what happens next? A patient takes Pidahi, Amla, Katu Ahar, Ushna Ahar, Atapa Sevan, Dhatu, Jagran, Madhya, Pan, whatever it is. All this increases Pitta Prakop, Rakta Dushti, and mainly these two guna, Ushna and Tishna guna, are increased. This is the first step. The next important step, which is being mentioned in the Grantha, which is very very important, is Dhato Prasikchate. What it means? The property of the or karma of Ushna Guna is Svedane Ushna. So this increased Ushna Guna in the body creates Svedan in the Dhatus. Now always remember, the meaning of the Svedan is is taken very limited, and it is related to the sweating only, and it is not correct. The exact meaning of Svedan is excretion of Jalansha from a Ashay or Srotas from inside to outside. The Svedane Ushnaha or Svedan means any Jalansh in internally or externally. In sweating, what happens? Jalansh inside the skin gets exceeded outside. Like that, in Jalansh present in the Ashaya is excreted outside that Ashaya or Srotas. And this definition is very important because it is needed in Sampratya Rakta Pitta and diseases like Udara also. So this is the Rakta Pitta. Next step happens, that is because of Ushna Guna, Svedani Ushnaha, Svedan of Dhatus takes place. What it means? Dravamsha from the Dhatus starts getting outside from that Srotas of each Dhatus. Dravamsha of Dhatus starts getting exceeded from their Ashay or from their Srotas. Now, this exceeded Dravamsha, what is the space where it can get accumulated? It is Sira or Rattava Sira. Understand? So, what happens if this is normal Sira with capacity of say 10 ml? Okay, now this exceeded water from the Jalansh, the Dhatus, Dhatu Prasichate by rule, gets starting accumulate in this Sira. Capacity is say 100 ml. Now the 100 ml is normal capacity, and now it is accumulated, say 300 ml because of this accretion of Jalansh. What will happen? The sera will try to accumulate, it will get tortuous, it will try to accumulate up to certain extent, but Jalansh is now continuously getting accumulated. At one stage, the capacity of sera gets over, and here the Tishna Guna also works. What is this? Bhedane Tishna. So it, because of Bhedan, it breaks the sera, and that's why bleeding starts. Understand? Tishna Ushna Guna, Svedane Ushna, Svedana of Dhatus, that Jalansh gets accumulated in the sera. Up to certain extent, it try to accumulate. When the capacity is over, it gets break, and this, for this breaking, Tishna Guna is also helpful, and bleeding starts from the body orifices without any external trauma is pratyakta. There are few other things of the Samprapti which are very important. We will discuss in the next lecture. Thank you very much.